Okay, so hello again. This time I will share with you our study also conducted in our center by me and Dr. Karim Abdelawab about the preoperative cross-sectional imaging in pelvic congestion syndrome in patients requiring right gonadal vein embolization, the impact on the procedure efficiency and radiation exposure. My disclosures, I believe I should skip the intro. And of course, for the management, the embolization is considered to be the primary treatment for pelvic congestion syndrome cases. And for our study, the study aimed to assess the role of the preoperative cross-sectional imaging, CT or MR venography, in influencing the radiation exposure, the procedure duration, and the success rates of right gonadal vein catheterization and embolization in cases with pelvic congestion syndrome or the pelvic venous disorder, the primary form. And this retrospective review included 189 cases referred to the IR unit in our Center for Bilateral Gonadal Veins Embolization from 2021 to 2024. It compared the success rates, the procedure duration, and radiation exposure between the patient with or without preoperative cross-sectional imaging. Of the 189 cases, only 30% of the cases had preoperative cross-sectional imaging with the CT or MR. And while the success rates of the right gonadal vein embolization were similar between the two groups, those without imaging experienced significantly higher radiation exposure and longer procedure time. And in cases with a failed right gonadal vein catheterization, it reached up to 12% without preoperative imaging due to complex venous anatomy or absent reflux, with some refluxing right parauterine varices were originating not from the refluxing gonadal veins, yet from the internal iliac veins. And so preoperative imaging helped to identify the right gonadal vein anatomy. It also helped to detect non-dilated right gonadal vein, which is most likely non-refluxing, thus avoiding unnecessary catheterization attempts and reducing procedural complexity. And I will show you some cases. In this case, preoperative CT images, as we can see with the arrows. Let me show you the laser pointer. Yeah, it can accurately show the origin and course of the right gonadal vein and also the dilated tortuous left gonadal vein. And this facilitated the bilateral gonadal veins embolization to be performed at ease with short time. This is pre and post. I used here only foam sclerotherapy, and this was the catheterization of the right side. And this is post-embolization. We had other cases in our study where preoperative MRI cases, preoperative MRI imaging was performed, and where the gonadal veins were occluded with Glubron glue or coils. And in this case, this is dilated left gonadal vein that was also embolized successfully. And you can see here anomalous low origin of the right gonadal vein from the posterior aspect of the IVC. This image is with subtraction, and this is without subtraction for the right side. This case had no pre-procedure cross-sectional imaging. We needed about 30 minutes to reach the anomalous origin of this right gonadal vein, which could be just a collateral branch to the main right gonadal vein with another possible main origin for the right gonadal vein being missed. So this case needed further advancement of the catheter into the vein failed, and subsequently we only embolized it using foam sclerotherapy. So to conclude, under the guidance of experienced operators, preoperative cross-sectional imaging didn't significantly impact the success rate of the right gonadal vein catheterization and embolization in our study. However, it reduces the procedure duration time and consequently the total radiation dose received by the patient, and therefore we strongly advocate for adopting the preoperative cross-sectional imaging CT or MRI as a complementary step before undertaking the right gonadal vein embolization procedures. Thank you.